So in last lecture, we have seen about denture insertion. Okay. And in today's lecture, we will discuss regarding post-insertion problems. Okay. I hope I am audible to you. Okay. So in this lecture series, we have completed from impression making to insertion. Okay. After insertion, we are now taking discussion on or lecture on post-insertion problems in complete denture. This is again on a large, long answer question for your final examination. Okay, so which things you have to write in your answer regarding post-insertion problems in complete denture. Okay, coming to us outline of our lecture. One first regarding introductory portion, afterwards denture assessment, then problems with newly inserted denture, okay, then direct sequelae of wearing complete denture. Actually, this whole chapter is divided under three headings. First is your denture assessment. Okay, today I hope I will complete this denture assessment. Okay, afterwards problems with newly inserted denture. Okay, and direct sequelae of wearing complete denture. Okay, so I hope I'm audible to you. Someone is raising her hand. Is there any problem? Okay. Topic is your post-insertion problems. In denture assessment, see which things you are going to check during after post-insertion. General assessment, denture-based examination, and tooth examination. These three factors we are going to check in denture assessment. Complete denture therapy involves complex interplay between biological demand and technical limitations. The success with complete denture is reported high. Dissatisfied denture patients do exist. We all know there is a dissatisfaction regarding our prosthesis with some patients. Okay. So correlation of problems manifested at the time of insertion and post-insertion phase requires what it requires, why they are dissatisfied, or we have to just check, or all this dissatisfaction depends upon, or how do we are going to rectify this. All these factors are depend on patient's patience. The patience of your patient is important, and as far as your treating doctor, your skill and your experience is important. Okay, already I have told you I have divided this chapter into three headings. First is your denture assessment. We are seeing or we are discussing regarding post-insertion problems and how to manage such post-insertion problems. Okay, first part is your denture assessment. First we have to do assessment of your denture and which factors, which criteria under denture assessment we have to evaluate. Just see one by one. Okay, now coming towards the denture assessment. In denture assessment, again there are three factors we have to evaluate. First is your general assessment, second is your denture based examination, and third is your tooth examination. Okay, Again, in general assessment, which things we have to evaluate? First, presenting problem. We have to take consideration of what the patient is complaining about. Then history, age, social factors, examination, and decision. All these things we have to evaluate in your general assessment. In denture-based examination, you have to check support, periphery, occlusion, and translation. Okay, as far as your tooth examination, color, height, contour, extension, and kinetics you have to be aware. See, it's little bit confusing now. Okay, see, again, I clarify this chapter post insertion problems. Okay, divided into major three things. First, your denture assessment. Second, problems with your newly inserted denture. And third, your direct sequelae of very complete denture. Okay, today we are going to see only denture assessment. Okay, in denture assessment also, we have to check for three factors. First is your general assessment. Second is your denture based examination. And third is your tooth examination. Okay, in general assessment, there are 6 things we have to check. In denture based examination, there are 4 things we have to check. And in tooth examination, again, we have to check for 5 things. Is that clear? Okay. Afterwards, see how to remember. See, number of factors are there, 5 factors, 4 factors, 6 factors. How to remember these things? So, for that, we have prepared one mnemonic for just for remember. Okay. What is that mnemonic? Mnemonic is phased, stop, check. See, phased, stop, check. Write down this mnemonic. Phased, stop, check. What is phased? Phased is your all general examination. Or your general examination. What is stop? Your stop is your denture based examination. And your check is your tooth examination. See, there are near about 6 factors here, there are 4 factors here, there are 5 factors here. So, to just understand or just remember, one mnemonic we have prepared, that is phased spots check. Again, I repeat one thing, that is we are dealing with post-operative problems. Okay, how to treat after insertion. Okay, in that we are dealing with denture assessment. First, we have to do denture assessment, and in denture assessment again, we have to consider 3 major factors, that is general assessment, denture based examination, and tooth examination. Okay. Again, in general assessment, we have to check for these 6 factors. In denture based examination, we have to check for these 4 factors, and in tooth examination, we have to just for these 5 factors. Little bit confusing, but just by remembering one mnemonic, we can remember this thing. Phased spot check. What is phased? P for your presentation, okay. Then H for your history. Then A for your age. Then S for your social factor. Then E for your if anyone have problem. Don't raise your hand, okay, or I will stop my lecture. Unnecessary, don't do anything which will. Okay, coming towards your phased. Present problem, H for your history, A for your age, S for your social factor, E for your examination, D for your decision. Okay. What is what we have to check in this spot? Spot means support, periphery, occlusion, and translation. Okay, all initials represent spot. And in check, color, height, extension, contour, and kinetics. Okay, so coming toward the general assessment. So initial assessment of problem and environment. P. Present problem. Is there any anatomical problem or problem related to your function, the patient's function, or any psychological problems? If there is an anatomical problems, just do clinical examination for that anatomical to clear out that anatomical problem. Okay. As far as your function is concerned, due to faults in denture base or your teeth position, that can be wrong, and the problem is arise just because of this, that will be considered in your function. And psychological, it is most difficult to solve the problem, patient unable to pinpoint the problem. So just presenting problem, in presenting problem you have to just consider three factors: anatomical, functional, psychological. Okay. What about history? Patient's expectation. In as far as history is concerned, just know what patient expects from you or his prosthesis. Okay. For attainable yet unmet requirement, detailed history followed by examination in specific area. But as far as history, here history is concerned regarding what patient's expectation from that prosthesis. Okay. Afterwards, age. What you should know about age: as age increases, there is decreased rate of functional and psychological adaptation. All these factors you should know. Okay. So before starting your procedure, say if the patient is my geriatric patient, okay, geriatric starts age from above 70, 60 years above, okay, that time one thing should be in your mind, that the patient's age is more, so there is the rate of functional efficiency of that prosthesis and psychological adaptation will be difficult for that patient. So initially you have to just yet this factor will be should be keep in your mind. Okay. And during the process, you have to just tell the patient like this. Just explain all the things to the patient. Okay. As far as social, in social again, speech, ideal denture. If you prepare ideal denture, then there will be no change as far as speech is concerned. And psychological reactions. Psychological reactions, you have to just instruct the patient that he has to remove his denture at night. Okay. In phased, see, we are seeing the general examination. Okay. In general examination, we prepared mnemonic, that is phased. Okay. In phased, we came up to yes, yes for your social. And in social factor, we have to just check speech and psychological reaction of the patient. Then again examination. E for your examination. What examination you are going to do? General facial morphology of the patient and localized tissue examination. What things you are going to check for general facial examination morphology? Harmony of denture, teeth and facial appearance. To know harmony of your denture. Okay. What is harmony? It is an all stomatognathing system. Okay. All things. In stomatognathing system, which are three things: your jaw, your teeth. Okay. And your muscle. Okay. In harmony means what? All these three factors are in harmony or are in relation to each other. Okay. We are replacing teeth here. Okay. One factor we are replacing here in the form of your prosthesis. So your teeth should be in harmony with other two factors, means your muscle and your jaw. So your stomatognathing triad will complete. Okay. And here they have informed us to check facial morphology. When you are going to check facial morphology, or when you will know that this facial morphology is right, for that you should know what is ideal facial morphology, what is nasolabial angle, what is mentolabial angle. Okay, what is mentolabial fold, nasolabial fold, what is philtrum, what is tip of nose, what is base of nose, how it should be. You should know first. First, you should know normal all things. Afterwards, you will deal with all factors, all problems with the patient. Okay, so as far as general facial morphology is concerned, one should know what is normal, how the philtrum should be, okay, how the mentolabial groove should be, how the nasolabial angle should be, okay, how the aloe of nose should be, okay, because if you inserted the prosthesis, if there is a change, but you don't know what is changed, then it will be more difficult. Okay, so all topics from recording history to dealing with post-insertion problems, all are linked together. Okay, as far as examination of local tissue, response of supporting tissue to the denture way, we have to just check the local tissue response. We will just see afterwards. And in mnemonic of your phased, D indicates your decision. Okay, even by just choosing or by just examining these four or five factors, don't come to conclusion that this is the problem. Okay, and I will solve this like this. No, it is not like this. Okay, because you are now doing only general assessment. Okay, already I have mentioned that this topic is divided under three main headings. Okay, out of that we are now doing only general examination. Denture exam. Okay, we are now dealing with denture assessment, and in denture assessment we are checking for general examination. Okay, and after general examination we have to do denture based examination and tooth examination. After this tooth examination we have completed one factor, that is general denture assessment. So we have not completed all things, or we have not checked all things, so don't come to the decision that I have diagnosed the problem. Okay, so this is one about general examination phased. We have covered it. Okay, coming towards the examination of your denture basis. What you are going to check in denture basis examination? First is your support. Mnemonic: spot, support, periphery, occlusion, and your translation. Okay, all these four things you have to check under examination of your denture basis. Okay, as far as your support is concerned, you all we know that maxillary denture base have dentures have maxillary foundation area is more compared to the mandibular. So my maxillary dentures have good foundation area, so good support I will get from my maxillary denture. But in mandibular denture, there is a less denture bearing area, so we get less support. Okay, and in that also, if there is any alveolar abnormal anatomy, that time we will get less support. Okay, afterwards, retention and support. I have to evaluate these two things, retention and support. See, examination of denture basis. Under this heading, I am talking regarding support. And in support, problems, maxillary denture, rare problem, mandibular denture. If there is any abnormality of alveolar anatomy, retention and support. Okay, retention and support, loss of retention. If there is a loss of retention, then your impression technique might be wrong. Okay. So evaluation. how I will know that my denture has good support? So just insert denture in patient's mouth. Okay. Apply finger pressure in tissue direction. Means what? Towards the foundation area, I have to apply pressure with my index finger on posterior occlusal section. Alternately, one towards right, again towards left. Good support means what? Denture should not move. If there is no movement, then good support will be. Okay. And if there is a movement means your denture base is rocking. Okay. And there is less support from your foundation area. This is one method how to check the support. Second method, just apply your disclosing paste. We have already discussed about the use of disclosing paste. What is that? This is the paste we apply on internal border, internal impression surface of denture. We insert denture in patient's mouth. Okay, just apply even pressure. Okay, remove the denture and just evaluate the internal surface of your denture. If the paste is even in thickness, means what? I get good support. And if there is uneven distribution of your paste, then there is a poor support. Okay, if such things happen, just we have to just relieve that area. Okay, because of which there will be problem in support. In spot after support, coming towards the periphery. As far as periphery is concerned, one should know that periphery means what? Is the proper extension. Okay, is your denture is properly extended to the depth of vestibule? Yes or no? We have to just check. Means what? We have made impression properly. We have prepared dentures as per our impression. But during finishing and polishing, there will be chances that we trimmed excess border. Okay, and because of that, there will be a problem of peripheral seal. Okay, so we have to just check for your extensions. Okay, so how to check extensions? Evaluation of your denture extensions. Now, first extraoral extension we have to check. Extraoral, how you are going to check extension? If your border is overextended, what happens? It will go beyond your vestibule and just raises your facial structure. The morphology of your face will be changed. Okay, so extraorally, if there is any elevation as far as the border of your denture is concerned, that means the border is overextended. Okay, just like this here. This is one correct borders diagram where the border of your denture is up to the depth of vestibule. See, this is my depth of vestibule. Okay, see how rounded this is. Okay, and this is the correct extension. If border is overextended, extraordinarily what you will see? The morphology is changed here. Okay, displaces the border tissue. See, this is the proper width, and this is a mucous membrane. Okay, oral mucous membrane, it has elasticity. Due to the elastic nature of oral mucous membrane, if borders are overextended, patient will don't do any complaint, but Initially, he will not complain, but afterwards, he will also notice. Okay, but you have to just see the overextension. Okay, and if it is underextended, then there will be a gap between your denture border and your depth of vestibule. Okay, so as far as intraoral evaluation of your extension is concerned, you have to just evaluate the denture borders. Afterwards, extension is concerned for maxillary denture, the PPS area also comes in your extension area. Okay, so you have to just check for extension of your PPS. You have to mark the PPS line by saying patient A. You have to mark PPS in patient's mouth. Okay, transferred this marking on your internal surface of your denture. Okay, first we have to mark PPS line in patient's mouth. Okay, from this hamular notch to this hamular notch, the starting point. Okay, and say ask patient to say ah. Okay, so the movable and unmovable portion, the junction between these two, you have to just draw a line. Means what? This is your PPS area. Okay, and this marking we have to just transfer on our prosthesis. If overextension is there, just we have to reduce that overextension. Okay, so same for lingual extension for your lower borders. What we are going to check? Ideally, your lower denture should not move by non-exaggerated or simple movement of your tongue. Okay, this is ideally should not move on touching the lower lip from side to side with tip of your tongue. It is it is a it is 100% sure that your denture will not move in unexaggerated movements. If patient is giving exaggerated movements, 101% your denture will not sit properly. So it means what? The 100% insertion or satisfaction is depend on patient's movement or how he is dealing with his prosthesis. Okay, so how we are going to evaluate this? Just retract labial buccal tissues. Okay, break the seal. Okay, see, with the help of your index finger, we have to just break lower lip, lower lip seal. Okay, and ask patient to elevate tongue gently. Okay, what we are checking here? We are checking lingual extensions. If movement is there, means what? Your lower dentures lingual borders are overextended. Otherwise, otherwise denture will not move as per the movement of patient's tongue. Okay, so retention and periphery of maxillary denture. How we are going to check PPSC? Again, we have to check again. As far as retention is concerned, we have already discussed two types of retention: one vertical retention, second horizontal retention. All these we have covered. Okay, but in dealing with problems with after insertion, we have to check the retention. Okay, so just view upward and anterior force on lingual aspect of your anterior teeth. With the help of your thumb or your index finger, just we are going to give anterior and upward pressure. If denture lifts from behind, means there is a loss of retention. And just like we can check for buccal seal, the buccal force on lingual aspect of posterior teeth on opposite side. Okay, we can check for retention of maxillary denture. Then mandibular denture, posterior extension of denture. posterior extension of denture. How to check? Just downward view pressure on anterior in downward direction. We have to just view pressure on anteriors with the help of index finger or with the help of your thumb, or we can grab like this with the help of your thumb and your index finger and just give a downward force. If it lifts from behind, then there is a problem with retention with your lower denture also, and we have to just mark the posterior extension of your denture. And anterior extension, just pull. Just opposite action we have to check for anterior extension. So in denture based examination, we have seen support, we have seen periphery. Now we are coming towards occlusion, and later we will see about translation. Again, I am clearing this that we are under denture assessment heading. In denture assessment also, again, general examination we have seen. We are now seeing the denture based examination, and we will see tooth examination afterwards. So in denture based examination, we have seen support, we have seen periphery, now we are seeing occlusion. So as far as occlusion is concerned, we all already know there is a freeway space of 2, we have to maintain through to 3 mm. Okay, even right and left contact on closing from rest position. Okay, bilaterally, midpoint of your occlusal plane of lower denture should be below the greatest convexity of your resting tongue. Okay, and the contact between teeth should be maintained at few millimeter of horizontal jaw exclusions. So as far as ideal occlusion is concerned, these 4 to 5 facts should be in your mind. Okay, afterwards, if there is an occlusal disharmony, okay, so you have to check for that occlusal disharmony. Okay, and you have to just deal with that occlusal disharmony. So occlusal disharmony, recently made dentures, what we have to check? Patient's response. If teeth seems to strike harder on one side, if patients give response that I feel harder achieving this side, I think there is